Hey guys, once again, thanks for being here. Tonight I'm going to be talking about how to recognize and deal with nursing burnout. This is a serious topic that I'm going to be talking about. For those of you guys that don't know who I am, my name is Jason Rozinka, and I have been a nurse here for the past 20 plus years, and definitely dealt with some burnout for sure. And this is something that, we get done with nursing school and we're all fired up. We're going to go save the world, save all of our patients, and we're all fired up. We get in there, and then all of a sudden, boom, you get knocked down, whatever it is. You have some bad days, short staffing, or maybe you just realize that, maybe this isn't for you, maybe this isn't something that you're going to like, and this is something that you worked all your way up through college to get to, and you don't know what to do. So number one thing is to recognize why you're burned out or what the issues are. There are different things that we can do to help with that too. So one thing to do is to do something outside of work. A lot of us just tend to work hard, and that's all we do. Either you're working your shifts and you're so exhausted that you get home and that's all you do when you're working those shifts, and you've got nothing else outside of work to do. I don't care what you're doing. Just get up and do something that you enjoy, something that you look forward to. If it's sports, activities, yoga, knitting, whatever it is, give you something that you can focus on that's going to give you some joy, something that you like to do outside of work. Another thing we can do is just to reach out for some help. There's people at work that you can talk to. If there's social workers or chaplains or whatever, if you're having issues at work, family, friends, other coworkers that might be having the same issues or had the same issues. It's good to get it off your chest and talk about it. Number 3 I got for you is just stop working so much. For the most part, nurses are not hired full-time, especially in a hospital setting, and there's a reason for that. It's a high stressful job, and the burnout rate is high if you're not doing what you should be doing to take care of yourself. So don't work so much. The more you work, the more tired you're going to be, the crabbier you are, the more apt you are to make some errors at work, some mistakes. So try not working so much. If you guys are working so much just to make bills or to pay your bills or to make ends meet, you're living outside your means, and that's why you have to work, and that just adds more stress to you. So yeah, identify what those stressors are. What's making you stressed? Is it the job itself? Is it maybe some coworkers? Maybe you're a nurse manager. Maybe it's the shifts you're working. You need to identify what those stressors are, and then you can deal with them. Another thing that we as nurses don't do enough, this is number 5 here, is we do not take care of ourselves. We're busy. If we're busy nurses taking care of our patients, we're putting the patients first, which means you're skipping breaks, you're not eating right, you're not going to the bathroom on time. There's all different kinds of things we do for patient care. Same thing with parents. If you're a busy parent, we're taking care of our kids, they go first, and we just don't take care of ourselves, and that adds up. It's one of the reasons why the obesity rate in nursing is so high, and the injury rate, we're prone to injury when we're not taking good care of ourselves. So take good care of yourself, number 1, and then number 2, it's your job and your family and everything else. But you need to take care of yourself, because if you're not healthy, you can't do your job. And then the last thing, guys, if this is causing this much stress in your life, maybe it's not for you. Change your jobs. This is not something that you need to sign up for and get your first job and just stick with it the whole time if you're miserable. It's not worth it. Life is too short. There are so many different opportunities within the nursing field that there's no reason why you need to stay with one job and be miserable. Move around. I've got a ton of coworkers I've worked with that were miserable working where we were at the time, and they changed jobs and they're like totally different people. We're not meant to be in a stressful job like that and not like it and take it out on everybody else around us. So a few of my tips, guys: recognize and deal with the nursing burnout, guys. You don't need to be burned out at work, okay? Hopefully this helped you out. If you guys like this video, like, comment, share, and I'll see you at the next one. Remember to play hard and eat well, guys. Peace.